Hi everyone, my name's Aayushi and I'm an obstetrics and gynecology doctor working in London. Welcome to our Eve Appeal video on gynecological cancers. We're now going to talk about how to make the most out of your GP appointment and what to expect from your GP appointment or any other appointments you attend. In terms of booking your appointment with the GP, you may wish to ask for a double slot to give yourself the ample time you need to discuss your symptoms with the doctor. To make yourself feel more comfortable, you may choose to ask for a female doctor to see you as well, or bring a friend or relative along with you to the appointment. We would advise that you wear loose, comfortable clothing before your GP appointment, as it's very likely that you will be examined here. It would also be useful to bring a notebook of sorts along, with dates of your symptoms and dates of your bleeding too, as it's likely the GP will ask you these questions. Finally, if you think you would benefit from a translator being available, make sure you ask for this when you book your appointment. In terms of what to expect from the appointment itself, the GP will begin by talking to you a bit about your symptoms, asking you about them, and getting an overview of your medical background. They may also examine you, which could involve doing an examination on your abdomen, but also an internal examination using something called a speculum. Following this appointment, there's a range of options the GP has to choose from in terms of what happens next. First, they may refer you on for further tests and investigations, such as blood tests. Second, they may offer you some treatment and ask to see you back again in the GP surgery. Third, they may discharge you altogether based on this appointment itself. But fourth, they may refer you on to see a specialist within a hospital clinic. Here at the specialist appointment, they'll also be asking you questions about your symptoms. They'll also perform the similar examinations that you've had done previously, but in addition, they may ask you more specific questions and ask for further investigations here. These could include additional blood tests, ultrasound scans, and something called a biopsy, which is where they take a sample of your cells and look at them under a microscope to see if there are any cancerous changes or not. Following the specialist clinic appointment, you may be asked to come back to discuss the results from your investigations, and you may also be referred on for further discussion. In addition, to keep yourself as healthy as possible and to reduce your risks as much as possible, we would advise trying to keep a healthy lifestyle with a good diet and an adequate amount of exercise, and to avoid smoking or excessive alcohol intake. We would also advise that you see your GP in order to book in for your cervical screening, which is a programme done for all women between the ages of 25 to 65 years old in the UK, where they are able to have cells from the neck of their womb screened to see if there are any precancerous changes or not. Thank you for listening to our Eve Appeal video. If you need any more help or advice, please feel free to look online at the Eve Appeal website or contact our Ask Eve Appeal nurses, either over the computer or on the phone, and this is available in a variety of languages to suit you. Thank you.